Okay, I'll be answering some questions about our radiation monitoring devices. So this is our dosimetry badge. It measures exposure to radiation. It has a piece of thin film inside that cumulatively gathers radiation over time. We get our ratings here from sending it off quarterly to a radiation detection company, and they send us a report back quarterly. So they're all sent in and then all returned quarterly. It should always be worn anytime that you're assisting in taking x-rays or even in the room if someone else is, which you shouldn't be, but if you have to be, just always be wearing it because it will measure the radiation you're exposed to in the room. It should be worn on the outside of your gown, usually at chest or thyroid level. The max permissible dose annually is 5 rems or 5,000 millirems per year for veterinary staff. So I have a report here, and let's see. So it shows the technician's name. Of course, it's backwards because my phone won't flip around. And then all their numbers here. So here for Tiffany, she has her current dosage and her yearly dosage and her lifetime dosage. They're all measured in millirems. So she is at 331 for her lifetime dose. For this year, only 41, and that's really 5,000 is the max permissible dose for the year, and this was April's report, so she's at way less than the max permissible dose, 41 out of 5,000. So she's doing well, and there you go. That's all about the dosimeter. So we're going to discuss our personal protective equipment, or PPE, that we have in radiology. At this clinic, we have, of course, the lead aprons and thyroid guards attached. We have these hand covers. So something else that exists are, full, whoops, here we go. Put them like that so they kind of fit around your fingers and put them on that way. And other clinics, have full gloves, which are also good to cover your hands if you have to position a patient. One thing you want to do frequently is inspect your PPE for cracks or holes or fraying on the edges. So I'm going to just kind of look this one over before I put it on. Whoops, hit the light. And just kind of make sure. These are pretty new, so hopefully it looks pretty good, and I don't see any holes or cracks or anything. But those are openings for radiation to go through if you do see them, so you would not want to put those on if you do see any cracks. And we usually leave them hanging here on the wall so they stay not wrinkled and should hold up for a pretty long time. Another thing other clinics have are safety goggles. We don't have those here, but they're definitely a good idea to wear during radiology, and if you can't, then always look away from the beam. We also have our dosimetry badges, with our names on them. And so I'll demonstrate quickly how to put the things on that we would normally wear. So our thyroid guards are attached, which is really nice, so you won't forget to put them on. Protect that thyroid. Just cross the straps in the back and Velcro them down tight, and then these are magnetic, so just get that up around the thyroid. And then you want your dosimetry badge here in the front. I usually just hang it right from the thyroid loop. And if you need to have your hands in the exposure, which you should not, then you would want to put these on too. But typically we've got this going on and we're all safe and ready to take some radiographs. Okay, we're going to be discussing general radiation safety. 3 methods of restraint used in radiology. There's chemical restraint, so sedatives, anesthetics, other drugs to calm the patient down. There's physical restraint, so actually just physically holding them down or in the position you need. And there's environmental restraint, so putting locks on the doors, that kind of thing can keep the patient contained. I have 3 positioning aids here. So I have our V-trough, that's our small one, we have other ones. There's a sandbag, And then there is a leash. You can also use like roll gauze or rope, and there's tape if you need to tape maybe a small exotic wing down, or even like if you're taking a carpal view to tape the paw down to the table. Those can all be used to help you with good positioning. Um, Distance and exposure time are related, so the further you are from the primary beam, the more protected you are from radiology. And if there's an inverse square law, so if you are if you double your distance, so if you were 2 feet away and then you're 4 feet away from the primary beam, your radiation exposure is actually cut in by a fourth. So you're 4 times more protected from that beam. So no one should be in radiology unless they actually have to help assist with taking radiographs to decrease any exposure. It can be somatic damage that x-rays cause, just damaging your cells as they are. It's an ionizing beam, so it messes with the cellular structure itself. It can pass through without causing any damage, but the more you're exposed, the more likely you are to experience damage, even if you're shielded. So the lead gloves, the lead aprons, the thyroid shields only protect against scatter radiation. You don't want to be in the primary beam, and those are only covering part of your body, so they're not covering your, your full head, your legs, everything like that is still exposed to all the scatter radiation, and those can experience damage as well. So you really don't want anyone non-essential helping unless they have to. Just making sure I'm covering everything. So along with that, of course, we should make sure that we get the best diagnostic image we can on the first time, because the more exposures you have to take, the more everyone's exposed to radiation. So that kind of goes with decreasing time, but also making sure you got it all right the first time so you don't have to redo anything. And then we don't want pregnant women in here for, like I said before, your cells are susceptible to radiation, but especially if they're developing cells. So the first trimester especially is really important to stay out, but you should stay out for your entire pregnancy, of course, because the fetus is really, susceptible to actual genetic damage from the electrons going through their cells. And people under 18 have a lot of actively reproducing cells, more than someone over 18 or at their adult age. So they're definitely more at risk being in the radiation room, and really they should never be in there, and they should definitely never help. That's actually a law. So no one under 18 and no one pregnant should assist with taking radiographs. And that's basic safety info for radiation. All right, we'll be doing our radius ulna x-ray today. We're going to enter our patient into the system. So ID, I have here in front of me, 281, and her name, Amy. Go down and enter first and last name in these fields. She is a female. You can enter her birthday to get the age to pop up. Okay, so now she has that. Our performing physician is Dr. Judd, and our technicians today are me and Victoria. And then hit registration, and we're set. Okay, so we'll be using our calipers to take the measurement of her radius. You'll just want to measure right in the middle of the bone where you'll be taking the x-ray, and in the cranial caudal position. And we have our measurement at 2.5 centimeters. So that's what we'll be using when we set up our x-ray. Okay, so we have our dog ready for her radius ulna view. We're going to click on new exposure, canine, forelimb. This is considered an AP view, and we're going to go down quite a bit on our KVP and MAs. We measured her at 2.5, so I'm going to go to 3 centimeters on that setting. Okay, so we're ready to get her lined up and collimated here. I have the little foam pad to help position and keep the radius straight since she's not super comfortable with it how it is. And then I have the leg tie so I can pull and get the whole arm in. And let's see if we can bring this out just a little bit. And then can she lay a little bit more? Yeah, good job, maybe. So you just want to make sure you have above the elbow and below the carpus.
Stay, baby.
And have it pretty lined up and centered right in the middle of the radius.
Oh no, it's weird.
And have your marker. This is her left arm. Good girl, May.
It's okay, maybe. Good girl. I know it's
Alright,
okay.
I'm on the foot pedal. Here we go.
It's okay. It's okay.
Here we
Alright,
go.
there we go. Good job. Good job.
All right. Okay, so I'll be entering Daisy Bell into our system for a VD thorax view. So you just go to register study, and her ID is 25662, which is on her chart, and then add her name. Then just enter the last name and first name. She is a female. We'll enter her birthday, which I think was in there already. Yep, that is her birthday. The performing physician is correct. That is the physician, and these are the techs that are going to be doing the x-rays, so everything's good. We'll hit registration, and she's ready to go.
Yep.
So we'll take our measurement for the VD view. We're just going to measure the thickest part of the eye. Sternum. I know, it's weird. It's weird. So that's about where she'll be. And that comes out to about 25 centimeters. So that will be our measurement when we go to take the x-ray. Okay, so we're set up to take our VD thorax view of Miss Daisy Bell. We have her in our V trough. Hold on, Daisy, good girl. And we just need to get it lined up in the computer. So we've got dog, click on thorax, VD, put it up to 25 centimeters where we had measured her earlier, and then we'll collimate her. So we want our collimation to be sort of from the thoracic inlet down to about the first lumbar vertebrae. She's kind of a big dog, but we've just made that collimation. So we have our marker over here on the right side, and Christiana's going to pull her legs caudally, and I'll be pulling her front legs cranially. Hold on, babe. I know, it's a little funny. You're doing so good. And we'll take our exposure. Hey, so I'm Chelsea Miller. Callie and I today are going to be shooting our radiograph of the VD pelvis view. Here, I'll take this and introduce Callie.
Hi, I'm Callie Hansen, and I'm going to demonstrate how to register our patient Abby Israels into the computer. So I'm going to enter the owner's ID number, and then Abby's name, and then the last name, and then her name again. She is female. She's 12 years old. We'll enter in her birthday as well. No, come on. And then performing physician will be Dr. Kat Judd. Select that down here. She's the one doing surgery on her today. Let's see, she is spayed, so we'll say altered, and then we'll just put technician here, and then sedated. Yes, she is sedated for this. And I'll press registration.
All right.
She's in the computer.
Hi, so we're here with our patient Abby. She's not anesthetized yet. We're just going to preliminarily take her measurements for the VD view. So we have our calipers, and we're just going to measure the thickest part of her pelvis. And she is a little on the chubby side, so squish in a little bit of that.
Try to look at
And you want to just have the calipers measuring as she'll be laying in the trough. So the x-rays will be coming in this way. So we're going to measure here. It's lining up to 25 centimeters. So that'll be our measurement when we go to take the radiograph. Okay, so we have our patient Abby here for her VD pelvis view. We're going to set our machine settings. So dog, hit the pelvis. And you can change the centimeters. We had her previously measured at 25 centimeters in a previous clip. So then hit VD. We don't have a technique chart here because of the digital radiography, so that makes things really nice and simple for us. So I will be pulling her forelimbs cranially, and Callie is going to explain the collimation and positioning of the hind limbs.
Yes, so while she's pulling the forelimbs cranially, I'm going to pull the hind limbs caudally and kind of rotate them in. Our collimation longitudinally is going to go just cranial to the border of her iliums, and then distal to her patella on this end, and laterally just lateral to her body wall is just fine. And as far as rotating medially, it helps to kind of bend because of her breed. It's so hard to rotate her legs inwardly anyway. We're gonna push them up, then rotate them, and then draw them out, and we'll get a better picture of her patellas directly over the trochanter right there. So I am ready whenever you are, Miss Chelsea.
Okay. Okay, so we just wanted to shoot another one where I'm the one positioning the hind limbs as well. So again, just push up, rotate medially to get the patellas as straight as you can, and then pull out.
Ready?
Yeah.
Oh, Abby, it's okay.
Sorry, trying to wake up a little bit. So there are a number of different ways to search for a patient using our digital database. So we have on the screen here, that was a rad we took today. You want to click on database, and then that brings you up to our various search options. So you can search by date range if you want to say like from, you know, October 21st, 2017 to today, then you can search that way. That would bring up a lot of patients. Or if you want to leave that off entirely, and it will search our whole database up until today, and you can put in the last name of who you're searching for. I'm going to be looking up a patient named George Murphy. So typing in Murphy, you have to search by last name, and that brings up several, but I know I specifically want to see George Murphy, and then you can click that. You can see the thumbnail views of the radiographs we took last week. And you can double click to review the study. And then you can look through all of his radiographs. Okay, so the reason you would want to do a barium study would be if you have a case of maybe recurrent vomiting, or you suspect a foreign body obstruction. The barium studies are really good to look for lesions in the GI system. And this will be, you know, after you've already taken radiographs or done an ultrasound. You would want to see barium if you couldn't find anything definitive on those studies.
Yeah, so the way it works is you feed the barium, or before you feed the barium, you're going to take survey radiographs to make sure we have a good line of vision, make sure we have good collimation, and we can see everything that we want to look at. Then we're going to feed the barium and take lateral and VD radiographs at time 0 immediately after it's been given, after 15 minutes, then 30 minutes, and then 60 minutes. And that way we can see how it's moving through their gastrointestinal tract, and then you just review the films to see what we can find.
Yeah, sounds good. Hey, so we're going to do our barium study here with Miss Pants. We have our barium drawn up in our syringe, and then we're just going to slowly give it to her in her little buccal pouch.
administered the full amount of barium. We've taken our survey radiographs already. We've already put our settings into the x-ray machine, and we've pre-collimated to kind of get her entire gastrointestinal tract that we need to take a look at. So we're going to go ahead and take our time 0 radiograph.
Okay. Okay, so we'll come back in 15 minutes. All right. We're going to take our 15-minute view. So 15 minutes have passed since our first view. We still have our same collimation and setting, so all we have to do is hit the foot pedal. All right.
I'm Victoria Barton. I am an LVT and Chelsea's preceptor. And so as far as Chelsea goes with her radiographic abilities, she has shown improvement in her positioning and her technique of collimating and making sure that the radiographs are taken appropriately. She's gotten more comfortable with taking radiographs, and she's shown growth in her ability to perform radiographs of diagnostic quality. And she works really well with the stressed patients, since we don't sedate every patient that comes through our door.
Thanks, Victoria.